Okay, so today I'm going to be inserting a female catheter. So first thing I'm going to do is obtain an order that this has been ordered by the physician. Next I'm going to gather all of my equipment. So entering the door, knock. Hello Mrs. Jones, my name is Kelsey. I'm going to be your student nurse today. We're going to be inserting a catheter to you today. So before touching the patient, I'm going to practice hand hygiene. Next, Mrs. Jones, could you verify your name and date of birth for me? Okay, excellent. Do you have any questions before we begin? Okay, so I've elevated the bed to a comfortable working height. I've closed the curtain, closed the door, have my equipment to where I need to, have a waste disposal bin at my side. So next thing I'm going to do is I'm going to drape my patient in the only exposed area that I'm going to be needing to work. Have the patient lift up her knees into a Sims position. Once that's done, I'd be putting on a pair of gloves, and I would be cleaning the area, perineal area. So then I practice bathing the patient. Once that's done, I remove my gloves, dispose of them, practice hand hygiene. So now we could insert the catheter. So I have my equipment here. It's never been opened. I checked the expiration date. Putting that in front of me. This is now a sterile field. I can't touch the inside, keeping it 1 inch border. Got my gloves. Now I'm going to carefully prepare the patient for the catheter. So I'm going to put this drape in front of the patient for my working field. This underneath my patient. I'm going to drape my patient. I'm exposing the area that I'm going to be working. And then I'm also going to put this down to extend my sterile field. Once that's done, before I touch my sterile field, I need to put on my sterile gloves. Carefully sterile technique when applying my gloves. Once that's done, I'll dispose of this, touching only the inside so my gloves are still sterile. Now I can touch all of my equipment. So I'm going to arrange this. If I need to obtain a urine specimen, I'd keep that off to the side. I have my catheter. Let's switch to my patient. So I have the iodine and the peroxide. I have my saline, which I'm going to attach to the catheter. Put some lube for inserting the catheter off here and dispose of that. I'm going to cover the cotton balls with peroxide, dispose of that. I'm going to remove the catheter and place it in the lubrication, dispose of that. Next, I'm going to start cleaning my patient. So with my non-dominant hand, I'm going to hold the patient as I clean. And then with my dominant hand, I'm going to use the cotton balls with iodine and slope downward. Dispose. Downward motion only. Once that's done, I can dispose of these tweezers as well. Now I'll insert the catheter. So I do have some lubrication on the catheter. So keeping a sterile hand holding the catheter and my non-dominant hand holding the patient, I'm going to tell the patient to bear down and carefully start inserting the catheter. I'm going to keep going until I see urine in the catheter, and then I go about another 2 inches. Once that's done, I'll hold with my non-dominant hand the catheter, and then I will insert the saline to inflate the balloon. I documented how much saline to my records. Once that's done, I will check for resistance. that the catheter is in place, I'll begin cleaning up my area. So I will remove the syringe, dispose of this. I will then secure this to my patient's leg with strap or tape, and I will put this down below on the bed rail. If I need to obtain a urine specimen from that patient, I'll do that now. Once that's done, I will clean up my equipment, lower the bed rail to a comfortable height for the patient, make sure the bed rails are up, check with the patient, do you need anything else? I properly cover or drape my patient, document everything that's been done, put the call light within reach, and that's it.